Uh, Thank you very much for inviting me to speak. I'm going to talk on, that's a very long title, Neuroendocrine Cancer Service in South Wales. Hands up anyone that's heard of neuroendocrine cancer or neuroendocrine tumours before today. Oh, it's just spattering. So I'm Dr. Mohd Khan, consultant gastroenterologist in Cardiff and Vale, but I'm presenting on behalf of the South Wales Service and incorporates a number of different organisations that I'll come on to. So neuroendocrine tumours or neuroendocrine neoplasms, NETs we call them. These are a few famous faces that have had NETs. Who's the first one on the left? Steve Jobs. Middle? Rita. And on the right? Yeah, Bollywood fan there. So Irfan Khan. So these are people who've had neuroendocrine tumours, and they are uncommon cancers. The incidence is approaching about 6 per 100,000. But the incidence is rising over the period of last few decades. And along the bottom here, you've got the line showing the increased incidence of neuroendocrine tumours, and the blue line is the incidence of all malignancies. So it is almost a rapidly growing cancer, and people survive for quite a long time. Some of them are aggressive and some of them are not so aggressive. So people can survive for up to 10, 15 years. So there's an increasing burden of people with NETs, and because of its rarity previously, their voice was just not heard throughout the world. And they can arise in different parts of the body. So mainly they come from the small intestine and the pancreas, but also different parts of the gut and the lung. And they can spread, and even when they spread, unlike other cancers where metastatic disease can be sort of end of life, people can survive with various treatments for a number of years, up to 10, 15, 20 years in some cases. And it's that period of time that really the patient voice was not heard throughout the world. This is our part of the world, South Wales. I moved there about 5 years ago, actually from the previous presentation from UCL. I moved across to South Wales about 5 years ago, and this is the makeup of the NHS. If you're not familiar with it in Wales, it's different to England, it's devolved, and the dots are the various hospitals, and the different areas are shown. They're health boards or health trusts. There's just an example of the boundaries that we had to cross in trying to improve patient care. So when I first moved across, I had a clinic, and people with neuroendocrine tumours were managed historically round in various different hospitals, and the different people that may or may not know how to manage neuroendocrine tumours. And a few of them started to come to see me, and they said they were suffering with various symptoms, gastrointestinal symptoms, anxiety, uncertainty. And at the same time, Net Patient Foundation, who are a charity, UK-based charity, conducted a survey in Wales, together with our National Commissioners, WISC, Wales Health Specialist Services Committee. And we started to explore the reasons why they had said what they said to us in the clinics. They had little nurse input, sparse information, lack of confidence in specialist expertise, poor communication coordination from the NET multidisciplinary team meeting, which was a regional meeting which we've actually improved on. And there was poor access to the specialist investigations treatments that I had access to previously in London and other parts of the UK, but it was a bit of a postcode lottery in South Wales. And there's a lack of attention to the symptoms and quality of life, particularly the gastrointestinal symptoms that people were complaining of. So, for example, one patient, and unfortunately, this patient is no longer with us. She said that she was going to the toilet 20, 30 times a day, and could not make it on the bus to see her daughter sort of 10 miles away, and that was her only form of transport. And through individual patient management, we're able to change her life and make the last couple of years of her life bearable, and actually improve the quality of life with some symptom management which we brought to her. But on a larger basis, we listened to the patients in South Wales, and WISC, which were our national commissioners, put together a task and finish group. Busy slide, but essentially we had patient groups, 2 patient groups from South East and South Wales represented, and we had models of service that we clinicians and the patients and commissioners put together, and these were appraised by the patient groups, the relatives, the carers, as well as external experts and external expertise and managers. We started to implement this service, but the important thing is that we continued regular stakeholders meeting at least every couple of months or so, including the patient representatives who fed back to the patient groups. We also did workshops with the patient groups to get their feedback on what we were doing and what we needed to change. And this is this is a really complex area of medicine. I'm a gastroenterologist. I find this area, even though this is my bread and butter, I find it so complex. But the cancer is there, and it's inoperable. You can treat it at various times, but it may not relate to their symptoms or their anxiety and their quality of life. And so we were finding that there was impairment in quality of life and impairment of symptoms that we needed to address at various times during the patient course. So we put together a multidisciplinary team. We improved on the existing one. We improved the processes behind the MDT. And this is a sample of what a lot of work went into this. It's improved coordination in terms of the local services that I'll speak about in a moment. These are our numbers, and initially, these are top left, the type of nets, lots of different types of nets. It's almost like an umbrella of different diseases. And we made sure that the pathways to each particular type of, for each particular type of person was with the right expertise through South Wales. This is a very busy slide, but we set up a NET specialist clinic, involvement of our oncologists, endocrinologists virtually, went down to the southwest who felt neglected. And we've got Kath and Kath who are in the audience, our specialist nurses that have trained up in the last year and a half, who've been vital and crucial as support for our patients through their pathway. We provided patient information and support, which was crucial. So obviously Kath and Kath are there, and Becky Taylor, who's on maternity leave. We did a hell of a lot of work, and that's on the slide here. But the main point is having that contact with the patients. And then we repeated the measurements. The feedback survey, the overall patient satisfaction at the beginning was 18%. That improved to just under 100%, 99% on a sample of 100 patients. Access to treatments improved from 12 to 40%. And that's because we were coordinating things better and trying to plug them into expertise in London, which we don't have in Wales. The information that was given, they felt they had more information and lead needed less. And obviously the access to the NET CNS was paramount. And this is the word cloud. A lot of negatives at the beginning, a lot of positives after. We focused on quality of life, and we used measurements. GI-NET 21 is a questionnaire, quality of life in NETs, and GRCRS, which is a gastrointestinal symptom rating scale. And these improved compared to the initial cohort with a statistical significance, statistically significant difference, as you can see. So this is the first time that coordinated care has been commissioned on a national basis for people with neuroendocrine tumours in the UK. And despite an extremely negative public image resulting in a poor service initially and historically, it is still possible to turn things around with honest, genuine and transparent engagement with patients and their carers. And I believe through co-production and an iterative method of developing a service with repeated feedback, which is really important, a successful service that is valued by patients is achievable. I'd like to thank everyone involved. There's a lot of organisations, a lot of boundaries that we've crossed. Valindra, Cancer Services, Kath and Kath are in the audience, WISC, our commissioners, and importantly, our patients who, some of which are with us and some of whom are no longer with us. So thank you very much.